identifying enhanced anti-treatment and anti-aging properties of these events. Suggested that anti-aging therapy receive a new and promising dimension to combine cancer treatment. This thought will be detection and prevention of hematopoiesis and related diseases. That's very complicated.
Thank you, Dr. Joe, for the introduction, and thank you, Intel and all the organizers for inviting me. This is my first time at Westlake University, and very excited. It's very honored. So, yeah, I'm going to quickly follow Dr. Chen Wu's talk, and then he's already talked about the clonal expansion. So we're going to talk about the clonal expansion phenomenon in blood of the clonal hematopoiesis. So, in large part of my research career, has been focused on the leukemia studies. And, but despite these 40 years of study, there's a lot of basic science and clinical science and medical science being developed. But the adult leukemia, the mortality rate for adult leukemia are still very high. So we're actually the whole field has actually started thinking about outreach. Because we have been actually the passive care, where the patient, we only care those patients when they have symptoms. At that time, that the disease is already very complex. And we are actually follow those patients from when they have symptoms come to the hospital and all through the whole course. And so when it's the past symptoms, the disease are very complex. It's highly heterogeneous and involved very rapidly. And so now that the whole community is actually consider the leukemia and all cancer as a complex system. Actually, it's an ecosystem. So targeting a pathway or one target probably does not enough. So that's actually thinking that there's really happening. How about when we look at the early, when we start like care them early. So Dr. Chen was just talking about actually during age, that actually there's a lot of cancer mutations, oncogenes mutations, and those small clones are actually currently in our normal tissues, normal organs. That's actually an aging phenomenon. And again, cancer is a clonal expansion. So we already now is finding normal tissues have a lot of clonal expansions. Although most of those clonal expansions probably not involved in cancer, but on the other hand, most cancer are coming from the small clones. So you can look at it early, and you can some ways to understand how those clonal expansions to develop, and the risk assessment, which kind of clones will develop into cancer, just Dr. Chen was talking about it. We might actually start to do cancer prevention and the treatment. So today, I'm talking about something to understand the clones, detection and prevention. And before we think about that, probably by targeting aging drivers can also prevent disease or slow down disease. But now we actually begin to see that targeting aging drivers are also a very effective therapy for cancer. Here's a little delay. Okay, so Dr. Chen they published in very nice 3 years ago a Nature paper that talked the whole body map. All the normal tissues and organs in elderly have the clonal expansion. But this clonal expansion phenomenon, due to the easier for the research, are actually discovered in the blood. So in 1914, actually even earlier than that, we already know that some blood cells can be clonal by looking at the X, Y chromosomes and so on. So actually 2014, so we already in blood cells can detect the oncogene mutations expand in certain colonies. Those in blood we call them clonal hematopoiesis. And this one, although this does not have symptoms, but now we know that many studies show that clonal expansions are associated with development of many diseases. And this morning, Xiaodong talked about the aging theories, that heart probably does not, the delivery of the brain does not proliferate, and so that may not be accumulating so much mutations. But when your blood cells accumulate oncogene mutations, and those blood cells will expand, and they will increase in the level of the inflammation. They causing all kinds of diseases, including the heart cardiovascular diseases. And the 3 months ago, just published Cell paper, that even our our tooth problems are dividing, or the inflammation caused the bone loss, or arthritis, or osteoporosis. So all of them can be linked to the clonal hematopoiesis. And of course, the clonal hematopoiesis can also expand and evolve into the hematological malignancies. So this clonal hematopoiesis is just very relevant, and in two senses. One is really pre-leukemia, and also are associated with development of many diseases. And also is a good model system, because the clonal expansion is relevant to all tissues, all cancers, but blood is easier to study. So this is a good model to study the clonal expansion. So therefore, today we talk about our research effort in 3 areas. So one is the detection and risk assessment. And again, the clonal expansion is just a phenomenon during the aging. There's a lot of clonal hematopoiesis. And in normal tissue, a lot of clonal expansion. Most of them probably will not get into the cancers or developing the diseases. Some of them actually is beneficial as a selection that deal with certain stress, actually is beneficial. So risk assessment is very crucial. And also that how do we intervene in those processes? Because for the high-risk clonal hematopoiesis, how we can actually intervene them and treat them early. And also how do we actually prevent these things from happening? Clearly, the genetic mutation happens all the time, particularly during after birth. There's the birth of growth. There's every cell cycle will have mutations. It's just even replication errors. Nothing to do with UV light or irradiation or whatever. Just cell division will cause mutations. But yet there's not much clonal hematopoiesis or clonal expansion during young age. Right? It's probably because of in the healthy physiological conditions, our normal stem cells, for example, hematopoietic stem cells, they proliferate faster than the mutant cells. Mutant cells are actually 6 cells, right? But during the aging environment, then, for example, when you have like inflammation, or when you have like the virus infection or something, high inflammation conditions, then the normal stem cells proliferation will go down, will be dead. But the mutant will be slightly more, because they're dealing with the inflammation conditions are better. So during the age that the mutant cell will get attracted. So that's because of our normal stem cells proliferation rate goes down. If we can prevent the age of our stem cells, we probably can slow down the aging cells or accumulation of the clonal expansion. So those are the ideas. So some work actually to understand how our hematopoietic stem cells age. The first one talk about the detection, and so because it's so important as a hematologist, we think about we also going to enter this field and start to care our patients from the clonal hematopoiesis point of view. So we developed our own clonal hematopoiesis detection panel, and we started to actually looking for the mid-age, elderly groups, normal individuals, healthy individuals, and we find that indeed the clonal hematopoiesis are correlated with age. You're older, then have more clonal hematopoiesis. This is like everybody's study. And actually, this is data in China. We really see there's a lot of clonal hematopoiesis. A lot of people have clonal hematopoiesis. So probably more than 50%, about 60 years old, will have clonal hematopoiesis. And also, when we look at these mutations, okay, this is also they're also correlated with very well with the aging biomarkers. So again, this is the aging process, the aging phenomenon. And when we look at their mutation rate, and it was really interesting because we include our cohort in 100 or so centenarians, people older than 100 years old. We find them also have a large number of clonal hematopoiesis. 70%, 75% of the centenarians will have clonal hematopoiesis. Then you immediately think that people live 100 years old are successful people, right? If they have clonal hematopoiesis, that probably means the clonal hematopoiesis may not be all bad. And so that so we have to really think, and particularly the centenarians, they have much higher tattoos. So maybe you were thinking that tattoos might actually have some protection rules, but those are the future investigations. And indeed, in the meanwhile, last year, there was one study the published in Nature Medicine and showed that clonal hematopoiesis is actually associated with protection from disease, Alzheimer's disease. So there certainly is that clonal hematopoiesis can not hold back. Sometimes actually can do good things. So the important thing next is when you detect clonal hematopoiesis, you cannot just tell all the others it's terrible and now we should intervene or treat. We have the next important clinical question and also very important scientific question is actually the risk assessment. Which one is bad and which one we should take care early. So, and how to do this one is, of course, this is like a long-term study where you could probably continuously study this one. But one thing is probably that's associated with the higher risk of clonal hematopoiesis, which is if the clones are grow faster and grow large. There's 10% blood cells that all have the oncogenes expansions. And those are associated with higher, more severe disease. For example, lung cancer has a lot more clonal hematopoiesis. The clonal hematopoiesis in lung cancer are associated with poor prognosis. And but when you look at data closer, only those the ones have larger than 10% in the clonal hematopoiesis. Larger size are associated with poor prognosis. So suggesting the larger size of clonal hematopoiesis are a higher risk group. So we look at our data and say what factors are associated with larger clone, faster the clone. And to our surprise, we think that this is the aging process. And so like I showed you earlier, that having clonal hematopoiesis are closely positively correlated with the age. And also positive associated with the aging biomarkers. But a surprise to our surprise is that actually the size of the clonal hematopoiesis, meaning that having 10% or larger clones, are actually not correlated with the age. And that's very surprising find. And also not associated with the aging biomarkers. Very different clones, clonal hematopoiesis. Again, having clonal hematopoiesis as age related easy. But developing faster and have higher risk are not age related. So what are they associated with? Actually, it's associated with higher mutation rates. So it's not more like a larger number of mutations. And now we actually sequence the whole genome of those patients. Now, it's not, the study has not finished, but here are the intuitions that those people have larger clones actually have germinal mutations. And they are actually bad luck. And those are bad genome that making those have prone to developing cancer. And what is interesting, those the germline mutations or centenarians does not have. So when people live longer, they don't have the bad genes. But people have higher disease potentials have bad genes from caregivers. All right. So, and also we look at all the leukemias, and we see that one is really interesting. There's, of course, in leukemia, there's the pediatric leukemia. Children can have leukemias, and also there's adults. But those are two different kinds of disease development. And if you find that for the pediatric leukemias, most are associated with chromosome abnormality. Those are during the development, the chromosomes, they undergo some ADP recombination or so on and so forth, that have chromosome abnormalities. But in adulthood, elderly leukemias, and mostly are coming from the chromosome abnormalities, are accumulation of one mutation. So, how we can actually intervene? For those ones, for large clones, clearly they are going to be bound to have something bad to happen. Either could be some leukemia or could be cardiovascular diseases, either or so on. So for those high risk groups, how we can intervene? But because we still don't have the symptoms yet, we have to anything we try has to actually start from the bad diseases. So we are actually thinking about, because it's an aging process, if we can slow down aging, or anything that intervenes aging might help to intervene with the clonal hematopoiesis or anything related, disease related. So we actually thinking that, with a hematological department, that we're actually using the cord blood and for transfusion and all that. And during a long period of time, we find that patients have cord blood cells. This does have some anti-aging signs. And also some patients have the cord blood transfusion for that, the hair turns black. So we are actually thinking that can we actually treat our patients with as before as a combination therapy. So we actually did one trial for the AMLs, for the elder AMLs. We know that the elder AMLs, the long-term survival is very dismal. Probably like it's people, the 60 years old and older AMLs, and most of them are actually older than 60 years old. And their 5 years survival is less than 20%. Very, very poor situation. So we actually did a clinical trial and studying a finish to 51 patients, and here's the results. And what we do is that through the chemotherapy we introduce like a new revision. During consolidation therapies, we add 2 infusions of cord blood. I'm getting cord blood. So actually, here's the results for 5 years study. And our normal control patients are actually, again, they're 4 years, 5 years survival, probably near 20%. So now, just to simply give 2 cord blood infusions, this is not transplantation, this is infusion. Actually, up to reach like 60%. This is really dramatic. And hopefully, you can do the third. We will do phase 3 trials very soon. If this one can hold true, this is a kind of revolution in the AML therapy. So again, we did single cell vision and see what happens and what the cord blood do. course, probably many things. There's many publications that they have extracellular vesicles, active many mechanisms can actually mediate this anti-aging effect. But what we see is at least one aspect could really helping to treating the cancers is that we find that the T cells are NK cells are dramatically increased after the chloroplast infusion. And also the myeloid cells, the immune inhibitory myeloid cells actually can decrease. That's actually aging. With aging, the blood age, the myeloid cells, the inhibitory myeloid cells increase, the lymphocytes goes down. Actually, the chloroplast actually decreases. So you can imagine that's really helping to curbing leukemia, killing leukemia cells. And you can see that closer, you can see the T cells are really rejuvenated. You can see not only really expressing the T telomerase and also the telomere maintenance, the whole 9 yards, the whole thing, telomeres actually are increased with the lens. And now we're actually thinking that the implications, again, this is the thinking which need to be really true. So in the beginning, for decades long, we are actually treating cancer by the three major the treatments. One is the surgery, removing the cancer, or radiation, or chemotherapies. They are actually just primarily targeting cancer cells, removing cancer or kill cancer cells. But in the past the decade or so, or 2 decades, the awareness began to see there's a revolution that actually for cancer therapies is by having the checkpoint inhibitors, PD-1 antibodies. That one is actually not targeting cancer cells, but targeting immunity, removing the inhibitor cancer immunity inhibitions. So this one really revolutionized the cancer therapies. And this we can consider this is a second dimension. It's probably literally the second dimension because now all the existing cancer therapy, all drugs will be aligned with the PD-1 antibodies. And 2 years ago, I saw a report that the registered clinical trial for PD-1 plus X is a 55,000 trials going on. So literally everything has to be combined with PD-1. At least we try, and some of them does have effect. So this is second dimension. So now we probably began to see that our third dimension, anti-aging, targeting aging drivers. So I could suspect that anything that maybe is later on improving the aging conditions, that changing the, because the reason why young people do not get disease or recover faster because their environment is much better. Okay? The immune system is much stronger as well. So I was proposing that in the future we can probably add a third dimension, anything that existing cancer therapy process, the cancer immunotherapy therapy. If you add anti-aging, we could see much better outcomes. Because just simply one, when you do the checkpoint inhibitors, if the cells are already exhausted, that's not going to do anything good. But we can actually rejuvenate those cells. That might be actually really improving the therapeutic outcomes. The way actually so for those one that have a more severe clonal hematopoiesis, for example, there's something like a really regional areas, hematological department. We usually don't care about these patients because we cannot diagnose them. So they are actually the anemia. They actually some patients are so severe they need a blood transfusion to survive. But because we cannot diagnose either MDS or leukemia, we usually just let them go or give them some vitamins or something like that. Right? But now we can start to see if this is actually anemia that can cause clonal hematopoiesis. This is a case report in our department. We see that like someone has really severe anemia. We look at their blood and it's like indeed there's clonal hematopoiesis. We treat them with DNS vasotransferase inhibitor plus the umbilical the blood transfusion. Now this patient is completely cured and they do not need blood transfusion. Now we start the trials actually to treat those more severe clonal hematopoiesis with this regimen. So I do not have too much time, so so we are actually also trying to study, okay, yes, this is anemia patients are elderly, are very, rate is very high. And age about the 65%, at least 17% of all anemias. Probably half of them are clonal hematopoiesis. In the future, it's probably a huge population need to be risk assessment and care. And I probably don't have time, or we're mostly skipping this stuff. We try to also understanding the how hematopoiesis stem cells age. Then I find is one is actually the ubiquitination, the E3 lipase, actually they're very high in hematopoietic stem cells, but during age, their actually expression goes down. And we find this actually, we knock them down, and we find this actually they have even like a typical aging phenotype. And we find that the reason, the mechanism is actually they regulate DOCK11. DOCK11 is the body nucleotide exchange factor for CDC42. CDC42 actually determines the hematopoietic stem cells, the polar. So the hematopoietic cells have the same niche, and within the niche they are polarized, but when they leave the niche, that polarization goes away, and start to actually proliferate fast and exhaust it fast. So that starts aging fast. So anyway, so if we can, the body nucleotide exchange factor is a enzyme. If we can actually inhibit this enzyme, we might actually slow down hematopoietic stem cell aging. And if our stem cells are healthy, that we do not have much room for clonal hematopoiesis. Okay, so I'll stand for I'm between the Shanghai and Hainan because he's doing the Shanghai Institute talking. And also we are actually jointly establishing a business field called International Center for Aging and Cancer. So also using last minute to advertising our meetings. Every year we have a meeting. The International Conference on Aging and Cancer. This year's topic is the common drivers for cancer and aging. And here's the speakers for this year. And speakers for this meeting are also our former speakers for America and Brian for our former speakers. And again, so you can so thank you very much.
Hi, Professor. First talk. I just have a general question. I wonder if there are some young kids or young cancer patients and the old